Hello, I'm Mike Durkee. I'm an orthopedic surgeon at the Steindler Orthopedic Clinic. I specialize in hips, knees, and shoulders. Today we're going to be talking about the knee. Specifically, we're going to be talking about arthritis in the knee and total knee replacement. So in the knee joint, there's ligaments on both sides of the knee that give you the side-to-side stability. Kneecaps up front. When you flip the kneecap over, then behind it, where the knee joint is where the cartilage is. So the cartilage is what's attached to the bone. There's a meniscus that goes around the edge of the knee on the inside and outside. When people say they have torn cartilage taken out of their knee, they really mean their meniscus. The cartilage is actually the cartilage that's attached to the bone. Arthritis is when the cartilage starts wearing down. So arthritis is loss of the cartilage between the thigh bone or femur above and the tibia or shin bone below. The cartilage doesn't show up on an x-ray, it just shows up as a space. If you're losing the cartilage, then the bones get closer together. The bone starts touching the bone below. So bone on bone knee usually is when we start talking about replacing the knee. So on the thigh bone side or femur side, you have to cut the bone and shape the bone. And then the knee, the prosthesis, the metal part, fits on to the femur. So you have to cut it perfectly to make it fit very nice. You can see that the metal piece is shaped just like a real knee. The curvature changes all the way through. The metal takes the same shape as the end of a real thigh bone does. On the tibia side or the shin bone side, you cut the tibia, the shin bone, and then the piece fits down. The metal piece on this side fits down inside the bone. And then there's a plastic piece. So this is a metal tray. It kind of gives this plastic piece more support. So the metal piece supports the plastic piece, makes it so it doesn't deform, stays nice and hard, more support from below. But it's a plastic, so the knee joint, the artificial knee joint is actually a plastic against metal joint. Plastic against metal is very smooth. It's smoother than a skate on ice, so that the knee moves very smoothly than one on top of the other. Now these two pieces are not connected together at all. They're just there. So the knee depends on your muscles pulling the pieces together, and of course the two ligaments that are on the side of the knee help hold the two pieces where they belong. But the knee can actually, as the knee bends and moves, the knee actually also rotates a little bit so that the pieces not being connected allows that to work that way.